So, Dr. Shih, would you mind introducing yourself to our MedStart audience?
Oh, absolutely. Thanks. So I'm Dr. Kendrick Shih. I'm currently the Director of Student Affairs at HKUMed. So I've been in this post for about 6 months now. I started later last year, but I've actually been in the faculty for over 10 years now. So I graduated from HKUMed in 2009. Afterwards, I finished my internship and I came back to HKUMed as an academic staff in the early career scheme, and I trained as an ophthalmologist. So I had the unique experience where I was both training to be a specialist, but at the same time teaching medical students. So yeah, I've been here for quite a long time now.
What effects do you think the medical curriculum has on a student's well-being, and how do you think we should mitigate these effects?
Yeah, so I think the most important thing to know about the medical curriculum is that it is very intensive. And I think the type of intensity and stress that you get is different. So in the preclinical years, it's mostly about rote learning. It's about memorizing things, reading everything over and over again until you're ready for the examination. But by and large, a lot of that is under your control. So as long as you prep the material, you don't leave it until very late, then it's manageable. I think the only thing that is the difficult part of it is the volume, how much you have to know. And I think this is most clear in year 2. Getting through that is important because it's almost like a rite of passage that you can get into the clinical years. So it is probably the hardest exam that you face, the MBBS 2 summative exam. Once you get through it, I think you're well prepared for the clinical years. So when we go to the clinical years, which is after the enrichment year in HKU, you have year 4, which is junior clerkship, year 5, which is senior clerkship, and year 6, which is specialty clerkship. At the end of all of this, you have your final MBBS examination, and then you become a doctor. Now, what you'll notice is that for the clinical years, the stress comes from the uncertainty. So in an environment where you can control everything, where all the patients are surrogate patients, meaning that they're fake patients, everything tends to go smoothly as long as you're well prepared. But when you get to the wards, you realize that it can be affected by, let's say, the doctor, who is your examiner, having a bad day, being a bit moody, the patient not having a good day, being sick, not cooperating, giving you incorrect history, or not cooperating for the physical exam. So what you'll realize is that no matter how much you prep, things can just go wrong. So sometimes you might end up not doing very well in examination just because the patient wasn't cooperative. And I think the other thing is about the materials, is that when you get to the clinical years, there's just so much more that you have to know. And it's not possible for you to study a specific syllabus. It can really depend on what patient you're having. So again, the second uncertainty is how much you have to know. And I think 2 types of students react differently to the preclinical years and the clinical years. I think for somebody who strives on certainty, who does well as long as he knows or she knows what they're getting into, they'll do very well in the preclinical years, but they might have a lot of stress in the clinical years. Whereas somebody who is very flexible but maybe can't sit down and study 10 hours a day, something like that, they might find that they do better in the clinical years, whereas they might have some struggles in the preclinical years. In terms of mitigating these factors, I think it's twofold. The first is you still have to be prepared. So there is information that you need to study beforehand, skills that you do have to practice. But I think the other thing is also realizing there's a limit to what you can do. So you can prep as much as you can, but you have to accept that things are fluid and that you have to react according to what happens on that day. I think this is very good training for what happens in the actual clinical situation. So when you're doctors, you really don't know what patients are coming in. You don't know how they'll react, and you don't know if they'll accept what you say. And even for surgery, you can be very skilled at a procedure, but things can still go wrong. When I was a student, I had difficulty accepting this, but as you start to practice over the years, you realize it's inevitable. So it's just as much about being able to react to changes, new situations, as much as it is being very prepared for everything that you can expect. At the same time, it can be a stress for medical school, but at the same time, if you can develop yourself to be able to react to these situations, that can be your strength as a doctor as well.
So what do you think is most significant about providing student support, and what steps are HKUMed taking to improve that?
Student support is something that our deanery is really paying attention to. This is due to a recognition of the unique stresses that not just our medical students have, but also our other professional degrees like nursing, pharmacy, medical sciences, and also our global health program as well. We have our counselors on hand, but they're not just there to help with mental health issues. They're there to help with learning issues and also just providing support. So that's one tier. But usually I think when you recognize that you need to see a counselor, it might be where you've already experienced some difficulties and you're already struggling. So what we want to do is add an extra tier above that, and that's providing support through our teachers in the form of academic advisors and also in the form of peer supporters who are your classmates who are specially trained in mental first aid, who are able to maybe talk to our students at a different level to our faculty. A lot of what we use to communicate between teachers and students were simply emails, and a lot of times it was mass emails. And I think the formal nature of emails makes it difficult to just communicate when you have an issue or you have free time. So it creates a natural barrier between the teachers and the students. So one of the things that we're going to do is actually launch a new communication platform. So it works almost like Facebook and Facebook Messenger, but instead of having it as an open program, it's a closed social network where our students are protected within inside, and you can freely communicate with your staff, with each other, and also with faculty and administrative staff as well. And I think not only does that make it easier to get help or to seek advice, but I think it also levels the playing field. If you come from a school where there isn't a track record of having seniors in here, then you really don't know anybody. So I think having a communication platform that is available to everyone, and you don't have to use your own personal WhatsApp or your own personal Facebook, I think that levels the playing field and makes everyone accessible.
And finally, would you have any words for our aspiring students?
Yeah, so for students who are interested in medicine, I think the first thing is to get an idea about whether this career is suitable for you. I think if you watch television series, movies, sometimes it can be glorifying certain aspects of medicine. Sometimes they have the maverick doctor who doesn't like to follow rules, who makes the genius diagnosis. I think in reality, what you have to expect is that this is teamwork. And so this is something that it's not about having a genius, it's about being somebody who's on a team who can contribute to helping our patients feel better. So I think that reality is something that has to be known beforehand. And I think the other one is about how tough it is, not just in the medical school part, but just throughout your entire career. So a lot of students don't think about it at this stage, but imagine that after the age of 30, if you're a medical doctor and you're planning to be a specialist, you're going to be still taking exams all the way until you're maybe early to mid-30s. Whereas if you have classmates who went into other fields like financial fields, teaching, they'd be having their family, they'd be settling down, maybe their kids are already a few years old by the time they're 30s, but you'll be telling them that you're still in the library studying, just like they were during university. So I think that is also something you have to consider, especially if you're interested in having a family. Being a doctor is sometimes a bit difficult because the clinical duties that you have may clash with your ability to take leave, take care of your kids. So it's also something to be considering. The final one I think is to keep an open mind. A lot of people have an idea of what type of doctor they want to be, but my own experience, and it's the same with everyone else, is that every year that you're in medical school, the idea of what you want to be will change. And in fact, even during internship, you'll find something to like about every specialty. I think it's the nature of medicine is that there's something to like about it. So it's important to keep an open mind and also to explore all possibilities where you can. So that's just my advice.
Well, thank you very much for sharing.
Sure, my pleasure.